I would roughly say there are 1 million people with MGUS living in our country today. So it is important to understand that monitoring has to be done using a system which is less intensive, but at the same time has the ability to identify people who are converting to myeloma or having other clinical disorders.
The OxCom clinic is Oxfordshire-wide clinic which looks after patients who have certain conditions. Typically that is chronic lymphocytic leukemia or CLL or MGUS.
When you go either to visit your GP or you may have attended an outpatient appointment in the big hospital such as the JR, you would have had an array of blood tests most likely. Now sometimes in some patients we find proteins in there that we don't expect to normally find, and when we find those proteins, which are called monoclonal proteins, we then look at those and try and determine how serious they are. And in the vast majority of patients, they will never develop any issues with having this abnormal protein in their blood, but a small percentage will. And because a small percentage will, that is why we have developed a monitoring system.
For some patients, they will just be monitored with their bloods, which were taken regularly by their GP surgery, and then they're written to give details of their results. So generally that's just to say that they're stable. So they're kind of the lower risk patients. And then there are also patients which generally are spoken to by a nurse like myself. That part of the clinic is an assessment also of the symptoms that are happening for you, and so it's not just looking at the blood results, it's also looking at the symptoms. And then there's a further level which essentially might be if you're referred on to have a face-to-face appointment with a clinician if there's further investigations required or the symptoms are indicating that there could be a progression in your condition.
In the event that we determine that someone may have a high risk piece of data, then we would immediately get them to go and visit the haematology team, and they will go and have a consultation with the clinical haematologists who are very experienced with this particular disease, and they will work with it. In this situation where it's not serious, we will put you into what we call a community monitoring pathway, and that's what the OxCom service is. It allows us to be able to keep an eye on your health. Their GP may have been the person who requested the test in the first place, in which case they will get the results sent back to them as any normal blood test would be sent back. If the patient visited a hospital for an outpatient appointment, then we would actually email the GP in advance and give them a notification that their patient has now been added to this MGUS pathway. And what we then do is we give that GP time to be able to discuss things with the patient should they need to, and then we send a welcome pack out to each patient. Look at the leaflet and look at the information. We try and give guidance as to what would be the types of scenarios or symptoms where you may want to discuss with your GP if you feel like symptoms have developed in you that are related to potentially MGUS. If there are new symptoms in you that potentially could be linked with MGUS, then your GP will perform another blood test which will come through to the immunology lab, and the immunology team such as myself will look through that and see if there's any evidence that anything could have progressed. If it is serious, we contact the GP, otherwise we send back a notification that will say everything looks okay and there's no need to worry.
Patients are reviewed at different intervals. Normally it could be a 4-monthly review, a 6-monthly review, an annual review, or perhaps even 2 years. It really depends on the level of your condition, how much the symptoms perhaps are affecting you if you have any symptoms, and also what your blood levels are doing. So it's all about kind of understanding a sort of bigger picture of the patient's health and understanding if there's any what might be an indicator of any progression of their condition. When you get a symptom that you think might be related to the CLL, the best thing you can do is to monitor it for a certain amount of time, say a week or so, and see if it's still ongoing. If there is a symptom that is ongoing, you can report it to your nurse specialist if you are talking to a nurse specialist regularly, or you could report it to your GP. I think it's important to make a record of symptoms if something is changing. Perhaps if your weight was dropping, to weigh yourself regularly. If you had a lump or a bump, monitor it, and is it going up, going down, what's happening with it. Certainly don't hold on to it for too long if there's something that's changed that you're worried about. You don't, for instance, have to wait for your next review. It's important to reach out and report those changes in symptoms if you think they might be associated.
We only diagnose 6,000 odd people with myeloma every year, so not everybody with MGUS gets myeloma. In actual fact, a very, very small percentage. But by providing the monitoring, we are reassuring people who have monoclonal gammopathy, and we're also reassuring ourselves that we're doing the best for patients. But it is critically important, we are going to put through large numbers of people with monoclonal gammopathy like yourself who will never end up getting myeloma.